Hello everyone. As promised, this is our first video. And the first question we're going to answer is, what's the difference between health insurance, vision insurance, and how do they work? Or how can you get the biggest bang for your buck? So, health insurance, as we all know, helps us take care of medical expenses. Something that a number of folks don't understand is the deductible portion. There are low deductibles, high deductibles, and that has an impact on your monthly premium. Typically, if you choose a low deductible health plan, your monthly premium is going to be higher, and vice versa. All right, so in your situation, you might be wondering, okay, doc, so should I choose a low deductible plan? Should I choose a high deductible plan? The idea is, if you're a fairly healthy individual and you don't have very many health issues within your family, you'll probably be okay selecting a high deductible plan and getting either a flex spending or a health savings account along with it. And this is why. Likely you only go to the hospital if you have emergencies, broken bones, accidents in general, because you're a fairly healthy individual and your family members are healthy as well. So as you save money onto those accounts, either flex or health savings, this allows you to take care of the expenses before you meet your deductible. Okay? And that's really the smartest way to utilize your money, because you could even say to the doctor's office, hey, I'm not using insurance today. What's the cash price? And then you can use your flex spending or your health savings account to take care of that medical expense. If you're having more than usual doctor visits, you have serious conditions that require more intervention, then it would make better sense to have a lower deductible plan, because you're going to use it up faster, and then you take advantage of only having to deal with copays. Medicare is a great example. Straight Medicare, directly from the government, the deductible is fairly low. So older patients who have to have multiple doctor's visits, they typically meet their deductible within the first few months of the year, and that allows them to have their expenses covered in general. Now, keep in mind, there are different Medicare plans out there. So you need to be careful as you're making choices. I'm not an insurance agent, so I don't necessarily know, what suggestions they're giving you as the consumer. But I would imagine they have to meet quotas, and they have their favorite plans. They have bonuses they probably get from the companies. There is straight Medicare from the government, the card that has the red, white, and blue stripes. And the deductible is fairly low. It's less than $200 for the whole year. And you don't really have to pay a premium unless you get a secondary plan, because Medicare will cover 80% of your medical expenses, and then 20% is your responsibility. When you sign up for a secondary, the secondary will pick up that 20%, and that's why you pay that monthly premium. With the commercial insurances, they're Medicare, but they're Medicare replacements. They're owned by the typical commercial insurance companies. They just approached the government and said, hey, what if we take some of those patients off your hands? And then the government said, sure, why not? We can't afford to help everybody anyway, so go right ahead. And that's the idea. There are multiple commercial plans. They're not all created equal. The premiums are typically higher, and they have more restrictions. Not every doctor can accept those replacements. And they are a little more picky in terms of what they cover. So, from our standpoint, in terms of taking care of patients with diabetes, with high blood pressure, with other serious conditions, we see, in general, patients who have the regular Medicare tend to have less issues when they need things done compared to patients who have the replacements. So as you're talking to your insurance agent, you should ask them, is this regular Medicare or is it a replacement? And make sure as you compare plans that you're comparing apples to apples. Pay attention to the deductible amounts. And again, if you have the option of signing up for a health savings account or flex spending account, if you're a healthier individual, you should do so. All right. This is it for today. We'll touch up on different issues as we continue to talk here on our channel. Remember to subscribe, like our videos, and again, leave me comments or questions, and we'll address those questions as we continue to meet each other here. Take care. Stay healthy. Bye-bye.